Do you have a chronic lung disease? Are you struggling to manage your work due to your lung health out of control? Then this video is for you. Hey friends, welcome to this education sneak peek on pulmonary rehabilitation. I'm Shakila Devi Perumal, founder of Lung Rehab Voyage, a specialist in pulmonary rehabilitation, counselor, and psychotherapist. Today, I'm going to talk about one tool that helps you to manage your lung condition in a better way. Yes, you've guessed it right, pulmonary rehabilitation. Pulmonary rehabilitation is a gold standard lung condition management program that helps you to manage your condition symptoms such as chronic breathlessness, cough, pain, fatigue, or anxiety, depression, or a guilt feeling, or fear of others' judgment, or adverse effects of your lung condition on your heart and circulatory system. What is pulmonary rehabilitation? As the respiratory societies define, the American Thoracic Society and the European Respiratory Society, pulmonary rehabilitation is a comprehensive intervention based on thorough patient assessment, followed by a patient tailored therapies according to the patient's needs. What are the needs of the patient? Their physical needs, the psychological needs, and the social needs of the patient suffering the chronic respiratory disease to promote a long term health enhancing behavior change. So, as the definition says, the physical, psychological, and social needs, which points to the biopsychosocial model. So, the therapies are designed and focused towards that model to help the patient manage their lung condition in a better way. When you talk about the physical needs of the patient, here it is focusing on the patient's breathlessness, their fatigue, the weaknesses in the limb, which deteriorates their functioning capacity on a daily basis. And when you talk about the psychological needs of the patient, the stress, anxiety, depression, the guilt and the shame, and fear of judgment of others, it's focusing on the psychological needs or psychological needs of their patient and they're also their family. And when you talk about the social needs of the patient with chronic lung disease, it is their lung condition which is having an impact on their occupation. So all these components vary in a granular status combined forms the pulmonary rehabilitation. It is beyond just an exercise program. And pulmonary rehabilitation provides education and support in better understanding your lung condition and also to cope with stress, anxiety, low mood, and guilt, and also the mindful awareness of the breathing and communicating with others in more confident way and managing a healthier lifestyle pattern. So, in a nutshell, it is, as you can see, it is a one stop shop for the patient needs to manage the lung condition in a better way to have a better quality of life. The benefits of pulmonary rehabilitation, the statistics reveal globally only 3% of population is able to access pulmonary rehabilitation. So, research has documented the reasons for these barriers and challenges are related to the organizational level, the practitioner level, and the patient related factors. And when we talk about what is the main reason in relation to these three domains, is the knowledge gap. The knowledge gap in the organization among the practitioner and the patients and their families. And then next follows the funding. And thirdly, the access to pulmonary rehabilitation. In most places around in the UK, a primary care venue doesn't have a pulmonary rehabilitation attached to it, but in a distant place or location where the patients are not able to access very easily. And the COVID-19 challenges have encouraged people to renew the vision of healthcare delivery. And overall, the healthcare delivery has been now renewed by delivering in a remote setting. Still, the access to or recommendation to or referral to pulmonary rehabilitation is very poorly. And the data of only 3% able to access pulmonary rehabilitation globally is very awful, as the statistics from the Health and Safety Executive in UK. In UK alone, 3 million people, about 3 million people have COPD. So looking at that, and globally, only 3% able to access pulmonary rehabilitation doesn't actually encourage good statistics of pulmonary rehabilitation utilization wider in UK. Here at Lung Rehab Voyage, we are aware of the challenges, of your challenges as a patient, and also about the healthcare setting and the NHS. And hence, we are delivering pulmonary rehabilitation in a safer telehealth platform. Please go and visit our website and book a discovery call, and we can tailor a best package to your needs. I hope to talk to you soon. Thank you for listening. Please share and subscribe to the channel and spread the word about pulmonary rehabilitation and mental health to people those you care in your life.